What we want to talk about today is patient-doctor etiquette, patient-doctor relationships, expectations, and specifically this phenomenon of internet MARPI patients coming with a lot of baggage that's causing a lot of the top MARPI providers, such as yourself, to have an aversive reaction to them.
Yes, yes. All the unreal expectation, or you know what we're talking about. All the negative side effect make us start to shy away from treating a lot of patients.
Yeah, can you say more about that? So, what are you seeing? How does one of these problematic internet patients present normally?
Problem patient present normally usually is before they even come to your office. They call my office, ask a lot of detailed question, requesting me personally talking to them, or just ask random question about certain doctor do certain thing. What do I think uh, from the beginning, from the get go, that this patient, my front desk usually warn me, say, hey, this patient have a lot of question, a lot of doubt, a lot of uh, ideas they have already presented, and so it back in my mind start thinking about, okay, this patient might be potentially a problem for my staff and for myself. I may need to pay a lot of extra time on taking care of patients like those.
So, for
So
example, they might call and say, "Hi, does Dr. Ting offer MSE and face mask or something like that?"
that shouldn't be a warning sign. That will be that's a redundant question. If they find me on the internet, they know I do all those.
That's true. That's
They
true.
usually don't ask nice question like this. They usually ask question about what's your success rate, and what do you think about Doctor So and So, or I've been to Doctor So and So, and then something that I disagree, or Doctor So and So disagree with what you think. What's your opinion? Or they will insist on me talking to them on the phone without being my patient.
Mhm, mhm. So,
So
are they calling you because they wanna be treated with you, or because they see you as an authority figure and they're looking for you to vet another doctor on their behalf?
that exact mentality, I don't know. It could be simply they just want some free consultation. It could be they have a lot of doubt of their existing doctors. But either way, that doesn't present themselves well in front of a new orthodontist.
Right.
So I want you to look at it as this way: if you are a small business owner, right? You own a small business. That's exactly what orthodontist office is. We're a small business. Now, if I have a customer comes in, they will potentially give a lot of hard time in your business, give your employee a lot of hard time. Then, as a small business owner, your tendency is, you know what? These are the customers that we should avoid. Okay. So, as an orthodontist office, even though we're healthcare professionals, but we are also small business owner. When a person present to be could be a potential headache situation for the staff, for the whole office as a whole, that we try to, if you're a business owner, just think about this way, then you are thinking about, hey, maybe we should avoid this kind of situation because nobody likes drama in their own business. That's the bottom line. You might
Mhm.
like drama when you see a movie or watch TV, but or you like to see drama happen to other people. But if it comes to yourself, your own business, what you own, you don't want drama in the place that you earn your living.
Yes. Yes, as a small business owner myself, I can
Mm.
understand. JawHacks is a small business, and I'm frequently being contacted by people and starting to realize 80% of the work comes from 20% of the contacts. Also, I have a tax prep business where we service a couple of hundred clients out of our office, and we immediately can identify problem customers right
Yeah.
from the first phone call. Usually our problem customer will call and they'll say, how much for the tax return? What does it cost for the tax return? Whenever that's the first question, we know that's not the kind of client we're looking for. And then we say, oh, sorry, we aren't booking. We're booking out another 3 weeks. We can't see you for 3 weeks. I'm sorry. And then they say, oh, okay, I'll have to find someone else.
Yes. So
So,
you know exactly what I'm talking about. It's those kind of things that every single small business owner will try to avoid, no matter how good a doctor they are, no matter how kind they are, and we try to avoid inviting potential trouble to our own office.
so what does trouble look like when it arrives? Like, give me an example of a patient that you've gone too deep with, and what kind of suffering it causes for your staff and for you and for your business.
So, as an orthodontist office, when you first come in, we need a complete record. Okay. If a patient gives us hard time on complete record, then that's number one sign. And number two sign is when they come in, they say, "Oh, I don't want this. I don't want that. Um, I don't want to pay for this. Do I get this? Do I get that?" Then, as a small business owner that you're thinking about, this person want to come in to get all kinds of stuff from you for free.
Mm.
Then that defeat the purpose of me owning my small business to support my family to earn a living. So that's another warning sign that you will give it to the office a bad vibe. And right away, the front desk, the office manager will be alert. Okay, this is the person we're gonna have hard time collecting from.
Mm-hmm. Mm-hmm.
So those are some of the example. Like first of all, the record. I don't want this record. I don't want the record. I don't want the radiation. I don't want this. I can't really do my job properly without having the record, or even legally without having a complete, proper record. And as a matter of fact, I think any doctor who won't give you a consultation without your complete record, you should run away because it shouldn't happen.
Mm-hmm.
Record is there for a reason to protect, first of all, the patient, and then second of all, to get the practitioner full spectrum of what we're looking at, so we can't miss the full record not having it.
Mm-hmm. Mm-hmm. What else besides resistance to providing records?
Besides, when
And
we
and
talk
and and
record,
also the other thing you mentioned was what should we call it? Nickel and diming. Oh, you're going to charge me for
yes,
records. You're going to charge me if the appliance fails. Do I have to pay for a second one? Uh,
yes,
is Invisalign more than braces? How much more? Why is it more?
hmm
When it's less work? These sorts of things, nickel and diming. That's a big problem for small businesses.
yes. Nickel and diming sometimes on this, sometimes I can understand. As a small business owner, nickel diming is very important. But when you give the impression that I don't want to pay for this, I don't want to pay for that, and then we know you are a not like to pay person versus nickel and dime person. Because a lot of nickel and dime person, once you straighten out the financial part, they actually become very pleasant.
Mm,
Okay, once the wall goes down, they become a good patient. But if a patient presents himself, you know what, I don't want to pay for this, I don't want this, I don't want that, then patient who want to choose a la carte, that doesn't happen. Okay, and like I say, if any office let you choose a la carte, then probably shouldn't be the office you should go to. That means the doctor is not doing is cutting corners, cut short on certain things. Okay, the second thing is um, we have so many filtering systems as when we see a new patient, we take record. So when they sit down in the chair, the patient sometimes start asking questions, or but not being friendly, or being picky, being critical on our staff, which is really, how those people go to a restaurant picking on waiter and waitress.
oh, I hate that. That's a huge pet peeve of mine when people
Exactly.
mistreat servers.
Exactly. Yes. Ministry people, they think it's lower than they are, which they are not. Okay. Then, then those patient, once they finish, my assistant usually will talk to the manager. The manager will come and say, "We don't want this patient." We have experienced that patient taking records, sitting down, my manager walk in, get rid of the patient. Say, you're not suitable for here. We don't like the way that you talk to my staff. They feel very uncomfortable. Okay. We have
Mm-hmm.
patients like that. We dismiss right away, instantly, without me even seeing them. Okay. Or my office manager will say, you know what, we had really bad vibe from this patient. Okay. Then I don't think we should accept this patient. So I go in there, do the best I can, and then give my little opinion, and then we'll dismiss the patient.
Mm-hmm.
Because
Mm-hmm.
after all, like I say again, any patient watching this, you have to understand we are also small business owner. We don't like to invite trouble in our office. If you sense that you are there just to give us hard time, give us trouble, or you are a very toxic person to deal with, then naturally, as any small business owner, we will not want to start any treatment with you, not even have a chance to start a treatment because it's going to make our life more or less impossible.
I think, doctor, I'm trying to put myself in their shoes, and I've been in patients' shoes before. They don't see the doctor like they see a business. They see the doctor as like a hero or a role model, and they want you to be larger than life. They expect you to be the one who has surplus, and they're the one who's lacking, and they want you to be. They come in with generosity and wisdom, and to be perfect and have no problems of your own. But the reality is we're all human. We all have stress, and we all have a limit and a capacity as to how much time we have in the day. And we're trying to protect that time for our health, for our sleep, for our wife and children. And we're not an infinite source of energy that we can give. And because we're small business, we don't work for a hospital. And when I say we, I mean you, the doctor. You don't work for a hospital, so you have a choice. And naturally, any business person will take the path of least resistance.
Exactly.
You
You're
have
absolutely
to.
right. You're absolutely right. And then I really admire you that, the kind of thinking you were as a patient, it's great. You you put a doctor in a really respected position. But unfortunately now at this environment, the respect to the doctor is actually quite minimum. Everybody is really into their own self bubble. Okay. A lot of people live in a bubble. They think they're the center of the universe. The whole world have to move around them. So so a lot of time where a patient comes in doesn't really have a lot of respect to the doctor. They come in, they want their way or the highway. Now, then I would prefer the highway because I treat patient the way I know best. I don't treat patient the way that you tell me how to treat because first of all, you're not even the orthodontist. Second of all, I'm the one with the most experience in this, one of the most experienced in this field. So I know what I'm doing best for patient. Not some kind of abstract thinking that you're thinking about when you sleep in the middle of the night. I can do this myself. I can do that myself. I'm not into that. I am into a predictable result. Okay. Again, go back to the small business owner as when you run a business, you want everything to run smooth and the outcome the way you want it. If you have a restaurant, you want every single dish comes out to the standard. Okay. So people will like, not some extravagant stuff that comes out and to some people that will like that the other people will not like. Okay. We have to have a standard that we can produce so I can be proud of my work, not to listen to crazy idea and next thing you know, we didn't produce the result. Okay. Producing
Mhm.
result and outcome is more important than anything else. During the process is not important, but the outcome is the most important part. But if I
Mhm.
know that the way the patient insisted on me on doing is not going to produce the result from my experience, then I'm not going to do it. That's the
Mhm.
bottom line.
Mhm. Mhm. I've often said to patients that sometimes the doctors with the best, the friendliest, most willing to sit with you to answer questions, respond to your text messages and phone calls and emails, they're good for philosophy, but they're not good for execution.
You
And I've said sometimes the best executor, which is what you don't need a friend, you need an orthodontist. The best
exactly.
execution comes from the person who's busiest and shortest, meaning he doesn't have time to necessarily talk to you so much because he's in such high demand and he's busy. And let me know if you agree with this point. Do you think an orthodontist in your position can treat a patient even if that patient is deaf, blind, and mute? All you need is the physical evidence in front of you, or is it necessary to have a conversation with the patient when you're providing these treatments?
So I treat patient to a certain standard that I need to be proud of myself. I had to have a seal, Ting orthodontics on top of it. So I routinely treat patient to the highest standard that I can achieve routinely. I always tell patient, if you think I'm overdoing it, if it's over treatment time, because often they win over treatment time, then let me know. I can stop at any time. But I'm not going to stop myself because my job is to do the best for patient. If you think the best is not necessary, then let me know. I can stop before that. So that's what the standard I give it to patient.
Hmm. Hmm. Yeah, I guess my question, doctor, is do you need to be able to have a 30-minute conversation with a patient to be
Really
able to
don't
give
have to.
them the best treatment?
Really don't have to. Let me give you a good example. For any given orthodontist, we'll talk about the whole industry. The most time I spend with you is in consultation. Because during consultation, I already have a treatment plan out for you. Okay, that's the most precious time there is. The first consultation. And then when I first come in, I look at the first time, I may review myself a little bit, say, hey, you know what? Did I miss anything? Because I always, every single paid time I see patient, I read myself. And afterwards, 5 minutes the most I need to look at everything, especially we do Invisalign in my office. So the Invisalign, the main design part is not at a doctor's visit. It's when I'm doing the clean check with Invisalign and design the whole thing. Okay. At the visit, all I do is looking at what's going wrong. Okay. Now, if I'm gonna see patient for half an hour chatting with you, then I will be have another 6 to 10 patient waiting for me. Then
Mhm.
the whole office become really disharmonized.
Mhm.
Then the staff gonna be talking about how chaotic it is in our monthly office meeting or
Mhm.
morning huddle, and they will start talking about, okay, this patient caused this issue. We have backed up, so we have to be aware of this situation. Now, does it necessary to ask questions for half an hour? Absolutely no, because we know what we're doing. Okay. If you worry about we forget something, all you need to do is give us a reminder. Sometimes tell patient, hey, you know, we're gonna do this and this and certain procedure in certain time. Okay. I'm writing it down in case I skip that. Remind me at the next appointment.
Mhm.
The patient remind me, I'm right on top of it.
Mhm.
But going through half an hour, talk about the treatment plan over and over again, because I don't know if uh, you probably don't know about this. Most doctor will know. The question patient asks you usually is repeated, same question over and over and over again. People have this tendency that if my answer is not the answer that they want, they will ask again. They will ask my assistant. They will go to front, ask my uh, front desk, and they will ask my manager. And then my manager come by to ask me, and I tell my manager, I told the patient 4 times the answer already.
Mhm.
The patient asked me 4 times from different angle. I give it exactly the same answer. Okay.
Wow.
So
So, mm,
that keep on asking the same question, it's not going to help. We have patients that doing that. So we have this policy that in the presentation we'll talk to the patient, say, you know, doctor spend time this treatment plan, and every single time with you, he will look at your treatment and then start a process every single visit. But however, if you request a personal time consultation, like, oh, I want to talk to Dr. Lee for half an hour, then there's an additional charge in addition to the treatment because that's unexpected. Again, that throw my time schedule completely off. Okay.
mhm.
To request a personal time to address the exact same question over and over again will be, you know, unfeasible in my office. So we do charge for an extra consultation. The fee that we charge is actually, some patient thinks a lot. It's actually pretty minimal for the half an hour or 15 minutes. My concentrated time on him, ignoring all the other patient. So we had to block out the whole schedule. It's actually a bargain for the fee
Mm-hmm.
we charge. But do I encourage that? No, because again, patient asking, repeating the same question over and over and
Mm-hmm.
over again.
Mm-hmm.
The same question that I answered 4 to 10 times. My assistant answered it 4 or 5 times. My front desk asked it, and we also had patient that every time we have a visit, it was in a whole page and a half email that my office manager have to go through and ask me and retype and type the whole thing to answer every single issue. When that happened, then my office manager would sit down with me seriously and tell me, you know what, this is not the patient we want. Okay, how we're gonna deal with it, because she doesn't have the time her schedule for an hour to take care of that. Okay, sometimes when they type the email page in half, take us an hour and a half to reply that. We don't have the manpower to do that.
Mm-hmm.
Okay, then again, you've changed yourself from the A-list patient to the bottom of the list that we don't want to keep this patient.
Mm-hmm. Mm-hmm. Yeah. Dr. Nuaz said to me recently that what orthodontic patients don't understand is that it's impossible to totally predict every data point in the future of the treatment, and that every appointment, to some degree, there's new treatment planning that occurs.
Yes,
And the repeat questions come from patients not understanding that.
exactly. Exactly. Repeat question. There's also some patient that encourage us to give them bad treatment. Let me give you an example. As I said it earlier, every single time I see this patient, I look at the patient as a brand new patient. Okay. My assistant know the treatment plan page got to be on. I will read the treatment plan. I will look at the patient, see what's missing. Okay. During the treatment, sometimes I find something that, hey, you know what? I could improve upon. Okay. Then it's my obligation to suggest to the patient, you know what? I just saw this. I found this. Okay. I think we should take care of it. But to take care of it, you need to do this. When you do this, then do that. You might require additional TADs. You might require additional procedure. Okay. Now, this for me, okay, it's a really good intention because that means I care about you and I look at and revise my treatment plan every single time when I see patient. Now, patients should appreciate that because that means I'm not setting treatment plan at the beginning and then just follow my plan blindly without revisiting it. Okay,
Mm-hmm.
because things could change. But there are usually two reactions. One is patient, great doctor, I appreciate you checking it again. I can see that. Let's do it. Okay. Or patient rather turn on me, start blaming. Oh, why didn't you tell me in the beginning? Why didn't you see this? Why
Mm-hmm.
didn't you do? Why
Mm-hmm.
didn't you that? It's not why I didn't, because this doesn't present it at that time. Okay.
Mm-hmm.
With those patients in mind, once they blaming start, right away I would say, that's okay. Because and this is the way I treat patient, I look at a patient as a new patient every single time. If I find something, I will let you know. But we don't have to correct this. We can leave it the way it is. We follow the old treatment plan. Then a document that do not
Mm-hmm.
revisit treatment plan every single time. So
Mm-hmm.
who's missing out? It's a patient, right? For me, my job's easier. I look at the documentation and say, okay, great. You know what? I don't have to pay my extra attention. They made my visit even faster. Patient just doesn't like changes, like to blame us from doing a better job.
Mm-hmm. I want to go back to the patient who sends the page and a half email. Have you ever had a situation where not answering the email or not studying the patient's questions and responding led to a worse treatment? Or is it all really wasted time and energy when patients write these novels by email?
It, it it is a lot of waste of time, but we always answer it. Okay, we always answer the email. If not the same day, the next day, within a week, we will answer the email. Because for those patients, when you don't answer, the second, third email will come. So, so to prevent more and more question, we answer it.
Right.
But when they start going too far, having doubt on my treatment, okay, my our first lines of defense is good. You got a consultation somewhere else. That person's a good doctor. We can transfer the case out to him right away. I have my office. We have an office manager calculate the amount, the balance. If you owe us anything or we owe you something, we clear out the financial balance, and that's it. Then we gladly send those patients out to the other provider that provided smart idea, that's smarter than us. Then let them finish what they have. Because once the trust is gone, then there's no point to continue with treatment. It will be really, really difficult because every single thing we do, they will have doubt and doubt this and doubt that. Now, I'm not discouraging you about second opinion. Second opinion should be done before the treatment start. Okay. My patient in our area usually go to 3 or sometimes even 5 different opinions. They should get it out of the system, but not during the treatment. You go to see a different doctor, get different idea. Then you get confused with the treatment plan. You lose the trust. When you lose trust, I don't want to keep this patient.
Hmm.
The minute we'll find out, we send patient away to the new practitioner. Why? Because once the doubt is there, there's no any form of treatment I can provide that will satisfy this patient without causing any headache to both parties. So
It's
the
like when a
better
wife loses trust in her husband, she'll never have it back 100%.
exactly. If you don't do any fun
Entanglements.
stuff, do it before the marriage.
Right.
After you have the commitment, then you commit to that person. Okay, you don't want to get involved with so many things. And
Hmm.
and the other thing is also I do mention to patient is that if today there's a patient rejected by Dr. Lipkin, rejected by Dr. Marianne Evans, rejected by Dr. Wakol, rejected by Dr. Audrey Yoon, come to my office. Would I see that patient?
No,
No.
no.
There's no way I see that patient because I know those doctors are very capable doctor. If patient reject them or they reject the patient, then I know there's something wrong.
Hmm.
If I call them, they may not tell me due to patient confidentiality, or we ask the patient to request a release of record. Then we know the whole story. Then we can decide to take patient or not. Most
Yeah.
likely, if you reject patient, if they're rejected by those doctors, then I know they're extremely capable. Then chances of me taking you on is 0.
Hmm.
So we have people.
Anytime, doctor, anytime I have a client who leaves one tax preparer and comes to see me, especially a big business that's looking for a new tax preparer, I say, what happened? Why did you leave the other preparer? And that is the number one question that can give you red flag indicators about what's happening with that client. Because a lot of times you get a lot of trouble clients that have left other preparers and people that like to, get a new preparer every year. It's a major red flag.
Yes, yes. So that's the same thing with us. Okay, a lot of time when we um, when we turn away the patient or we end up relationship with the patient because patient do interesting stuff in my office and to our staff that we say, you know what, leave my office and move on. Okay. Patients sometimes call back and try to argue with me and this and that. I say, you know what, before you go any further, I want you to know, don't burn any more bridges. Okay. If you want to be able to find a good doctor to treat you, meaning one of those doctor with a lot of experience, you need me to be on your side, or you need me to keep my mouth shut. Because otherwise, if you go to a different doctor who have equal, same, or more experience than me, chances are they will know me. They will know my standard of work. They will know my ethics work. So if you're a patient that being kicked off of my office, chances are you won't be able to treat by one of those more qualified doctors. Okay.
Yeah.
So
Yeah.
before they go any further, start doing threatening things, doing all kinds of stuff, then we explain to them, need to stop there. That
Mm-hmm.
burning the bridge, for some reason, people nowadays they like to burn bridges really easily. When I was younger, my first thing my dad taught me is never burn bridges.
Mine too. Mine too. That's the
That's the
one of
most
the first
important thing
things my dad
for
ever taught me.
for this new social media generation, as they burn bridges left and right. They think there's
Mm.
no consequences. But honestly speaking, how many doctors are really well versed, experienced on correcting structure and function in this world? You probably count less than two hands.
I was going to say 10 or less.
Yes. So if you really expect to be treated by a certain doctor that after and in my office to be taking care of in their office, then you better be in your best behavior so the other doctor won't have question and start contacting me. Okay. And I even tell the patient, say, you know what? You can choose to disclose they've been treated by me, or you can choose not to. Okay. I don't want to sabotage any chances you're getting treated properly by a good practitioner. So you make your own judgment. Okay. When you go in front of the doctor, you're gonna be talking a lot of trash about my office, which they know me pretty well, then that's not a good idea. If someone's gonna come in and tell me how horrible Dr. Lippian and this and that, I don't even give him a second chance because to
M-
me he's the best doctor in the world. So
That's a major. Yes, he's fantastic. He's my doctor for anyone who doesn't know. Shout
yeah,
out to Dr. Lipkin. Awesome guy. But I was going to say the number one red flag that I see in my tax prep business is when a new client comes in bad mouthing the prior preparer.
yes, that's a big red flag.
Number
Big
one.
red flag. Or someone comes in, right? Someone comes in, I want to sue this guy, I want to sue that guy. I don't
Hmm.
want to get involved.
Mm-mm.
When you come in with this kind of opening sentence, and then chances are we won't even start your treatment.
Yeah.
First, number one is I don't want to be the next bad guy. Second thing is I don't want to be involved in your
In litigation.
litigation process.
No. No, no, of course not. So let me ask you, why have you stopped taking patients from outside of the Southern California area? And is it the case that traveling patients are more likely to fit the description that you've been giving us about a troublesome patient?
Yes, that's what you're exactly right. That's what I thought in the beginning. Once I started treating a lot of a long distance patient, then I realized the headache I'm getting into. Okay, number one is those patients are not very trusting patient. A lot of them not very trusting. They will find all over the world to find a person they will trust and go, and then they will trust. It's the nature of the personality they don't trust. Okay. Secondly, is those patients that's unusually desperate. Okay, they might be a different aspect of their problem. Maybe correcting structure and function is not one of the issue. Maybe it's only part of the issue that I cannot resolve. Okay,
Mm,
people are complex.
Mm, mm, mm.
A normal personality won't go this far doing some procedure. We're not talking about treating cancer and save the son of your children's life. We're talking about a procedure that's immediately life threatening and go this far and that far to do certain thing. So those people have certain kind of personality than your regular patient. Okay. The third thing is when people from go through so much, they become very demanding. For example, if I see this procedure, do one procedure in two separate sitting, and I want to check you in 1 week, then the long distance patient will tell me, Doctor, do you know how hard it is for me to get here? Do you know how hard it's for me to get off work? Do you know how expensive the airfare is going to be? Do you know how to drive 8 hours to be here? That's not my problem. My only concern is to treat you the way to my standard. Okay. So to treat you the way to my standard require this. But I'm not your travel agency.
Mm-hmm.
So I don't arrange your traveling. That's your personal issue you need to be aware of.
Mm-hmm.
Okay.
Mm-hmm.
So my job is not to worry about your travel. My job is say, hey, I want to check you 1 week for appliance. That could be a 30-second taking a look at it to make sure there's nothing inflamed about or nothing goes wrong. That could take 30 seconds. But you travel 8 hours. So patient's not very happy about that.
Right.
But this is the part for me to providing the standard that that I want in my office. So I can't
Yeah.
be part of that. And also patient being demand, I need to leave the office by certain time so I can catch the flight. I need to do this by certain time. Then we start treating patient with one hand tied behind my back. We start walking on wire. My staff being start complaining, hey, you know what? The patient's really demanding. I know he's from far away, but we can't accommodate so many different things.
Yeah.
Or they were asked to be squeezed into a certain appointment time that's impossible for them to squeeze in. If it doesn't happen, I don't like it. Let me talk to your manager. Let me talk to your doctor.
Mm,
Then
mm, mm.
all those patients become impossible patients. There's one thing I can say definitely is I have not have a long distance patient that people treated and finished to my standard. Okay, that
Wow.
takes a lot. Okay, I think long
Wow.
distance patient that's a lose-lose situation. Okay, first of all, they don't get the proper treatment that they will get as a local patient. That's number one. Okay, number two is we have a lot of hard time to take care of that patient. So
Mm-hmm.
it's not benefiting anyone. Okay, not
Mm-hmm.
benefiting the patient, not benefiting my office. That's why we stop treating those
Mm-hmm.
long patients. And just remember one thing: rules are made for people who violate it. Okay, certain rules were made because we got bitten. Okay, not just once and twice. And we're smart people. We learn our lesson. Then we know we see a pattern. People with travel long distance seeming have certain pattern. Those are the pattern we try to avoid because we
Yeah.
inviting trouble to our office. And again, back to the small business owner, is nobody want trouble in their small business. So in my office policy right now is if you start here and you say, oh, we're moving away, then we'll discontinue your treatment. We'll ask you to transfer. We'll ask you to transfer a couple of times. If you still give us a hard time, then we'll force you to transfer because we don't have to. Because our policy is we don't see long distance patient. Okay. Of course, there are people lie to us, and every rule there, people try to break it, go around it, think they can outsmart us. And that's when we have more and more and stricter rules because people would like to break rules.
Yeah. Is there any amount of money that would make you satisfied to treat these types of patients? Let's say you tripled your treatment cost. Would you still not want to do it?
No, 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 because number one is we're not liking a patient. We have a lot of people want to treat by us. Same as all the other um, very experienced practitioner, Dr. Lipkin. You see how busy he is. Okay, and and Dr. Dr. Maria and Evans, they're super busy. We're busy practice. We don't need the headache. I want my office to run smoothly. Okay, so everybody leave this office happy. That's my number one goal. Increasing the fee is not really worth the time. If by increasing the fee, some of my staff have to change, have to quit because they can't take the pressure, they can't take the abuse from patient, then it doesn't make any sense how much money I I earn. If it's a headache money, it's not worth it.
Yeah. I think it's like if we were to do the arithmetic on it, it's the 80-20 rule. These 20% of patients are causing 80% more work. And so
Yes.
doubling or tripling the fee would still not be enough. You would need to 5x it for it to be worth it. Then you could pay
Right.
your staff triple or quadruple, and then maybe they would be more willing to deal with the stress. But um, I don't think doubling or tripling is enough to accommodate these top percentile troublesome patients.
No, it's not. No, it's not. 20%, 20 times more, maybe, possibly,
Right.
but but not double and triple the fee. The fee. If I lose a staff, it's not worth it. And talk about
Yeah.
losing staff is a lot of patient thinking they can verbally abuse my employees. Like I say again, you see that a lot. People in restaurant throwing tantrums, give hard times. Why a patient on the phone telling my front desk, I don't want to talk to you. I want to talk to Dr. Ting. I don't want to talk this. I don't want to do this, or verbally abusive. No. As a business owner, it's my duty to protect my employee from
Mm.
those kind of abuse.
And, mm.
Then your patient becomes secondary. If you're abusive patient, I can dismiss you anytime legally. As a matter of fact, I could discontinue treatment without even give patient um, a reason why it does discontinue patient. All I need to provide is 30 to 45 days of emergency care. Okay. A lot of patients think that, you know, it's your job. You are legally need to treat me. No. Healthcare professional legally need to treat a patient if they're dying. Nobody died without orthodontic treatment. That's not a medical emergency. Okay.
Mm.
So I can discontinue as long as provide afterward care for 30, 45 days in
So
case
all
I
you're required to do is take out the appliance, remove the braces.
if I
Make
respect you, I give you a reason. If I don't want to, I don't have to give you a reason. And if I give a reason, could be lack of trust. Okay, that's a perfectly legitimate reason. Could be financial reason. You're not paying us.
hmm
Okay, could be
hmm
you verbally abuse our staff. Could be you being disrespectful. Could be any reason. I'll give it to you. Now, if a patient become verbally abusive to my staff, all it takes is the staff report to me and file a complaint. If they file a complaint, the patient need to go because
Wow.
legally I need to protect my employee.
Would you say now more than ever because it's so hard to find good help, doctor?
Exactly.
Everyone is struggling to find
I
good
just
help.
want to help. I don't want to come back to cause legal issue with me with the employee. So I tell my employee, anyone who you think disrespect you, if you think it's worth it to file a report, you file it. Once you report to me, I have to take action legally. I have to take action. So if you're being verbally abusive to my front desk, to my assistant, they file a complaint to me, you're out.
You're out of
I don't
there.
care how much you pay me. I don't care what middle procedure or anything. You're out because legally I have to take action. Okay.
I
So my
understand. That's
employees
an
kind of
interesting
right.
point.
Okay. So for those people who like to throw a tantrum in the restaurant, okay, it's not going to happen in my office.
What's going on with people's manners? Is it an age group that's worse than others? Is it people under 30? Is it people under 20? Is it all people? And it's just that the local clients, the local patients have less logistical headache, so they're less likely to have a trigger that makes them misbehave, or
Now,
what is it?
local patients are usually not demanding. All they want to do is look for orthodontists. Okay, when they find one, you treat them nicely. I think we can say every single orthodontics office, unless you go to a mass producing company factory, they're all nice people. I haven't met an orthodontist who's not nice. Okay, so every orthodontist are nice people because we're happy people. We treat happy patient. Okay, we're not treating patient in pain. Okay, so we're all happy people, and the problem is if a patient have a sort of a toxic personality, which is kind of like a pretty dominant trait right now, and the younger generation, say the 20 something, they come in, they demand a lot, they want to be the center of the universe, they think everybody is expendable at their convenience, then it worked really well at home when you throw those tantrums to your parents. But when in the real world and the society, when you have to co-live with somebody else, it's not going to happen. Okay, we have so many different things we have to follow to protect my employees, to protect my office from those little things that we cannot tolerate that, unfortunately.
So, would you go as far as to say that this is a Generation Z problem that we're talking about in terms of the disrespect?
Um, I don't want to say Generation Z problem, but I see a lot in the young 20s. Let me give you an example. Uh, we have a patient that we treated. It's a surgical case. Disappeared for a long time. Came back, continued treatment, and keep on questioning now why it takes so long. Despite we explained, you missed the whole 6 months, and you missed another couple months. Keep on questioning about, oh, why it takes so long, and insisting on jumping to surgery before it's ready. So I explained to patient, hey, your surgery is not ready. Okay. Then his response is, well, I don't understand. In Europe, they do this all the time, do that all the time. And again, orthodontic surgery, it's a very US thing. We're the most advanced in orthodontic surgery compared to European country. If you talk to Dr. Lipkin, he can tell you how many horrible pre-surgical cases followed by orthodontics. Then you will see how bad of an idea that is. That's why all the top orthodontic surgeons are in US. Okay. And I say, fine, if your oral surgeon willing to take responsibility, if anything doesn't go right, then they can do the surgery. If your oral surgeon say it's ready, I think it's not, he proceed with it, I'm okay with that. He talked to the oral surgeon say, no, you're not ready. Came back, throw a tantrum, write angry email, threatening bad review or whatever, every single thread in the book. My assistant received the email, feel threatened, okay, report to me, would dismiss the patient. Okay. And after we dismiss the patient, and of course, it's not very happy. You want us to get refund and this and that, or that Dr. So and so say you did a horrible job. So we replied email back to him. Say, look, you are a male in the mid-20s. We successfully did a skeletal expansion. Okay, that's already 99.9% orthodontists cannot do in this world. So we're actually very successful. You should be appreciated. Okay. And at the same time, if your doctor have any doubt about my treatment, have them contact me. I can explain everything. Okay.
Mm-hmm. Mm-hmm.
So first of all, he still didn't get the surgery because that doctor had to prep him for surgery. Okay. So it's not going his way. Secondly, if you go to a person that doesn't know me, that means that doctor is not really into structure and function correction. So you're not getting the same kind of treatment. Okay.
It's a bold statement, doctor. Maybe a little cocky, but it's true.
Yes,
It's true.
because if you're into those correction, there are a couple of names that you should know in this world, like Dr. Eli Lipkin, Marian Evans, Rebecca Buckle, or Arthur Jung. Okay,
Mm-hmm.
these couple of names you should be familiar with because we post and talk about this kind of correction all the time. Okay,
Mm-hmm.
so if you're going to a doctor that doesn't know me, then chances are that person is not familiar with this type of treatment.
Yeah.
Secondly, is if you want me to explain to the doctor, if your doctor makes such a comment, then I can explain to him what's going on in the whole treatment. Then chances are the doctor will think about what have I done? Maybe I should
Mm.
assist this patient. My point is there are not that many people in this world do this kind of treatment routinely on a regular basis. They might do it once in a while, but not routinely. Then chances of getting properly treated become less. So follow what I do my best is what I know best. If I know this way will produce result, then I will do the same way that produce the result, a good result. This is your research way. Some other people do this and do that, then it will achieve the same result. Okay.
Doctor,
Chances are,
I understand, and I completely agree. Um, internet weirdos, internet weirdos, patients who come in who ask for specific treatments, right? MSE, face mask. Can you make my lower jaw repositioned a little bit forward because my bite is more comfortable, more forward? Can you give me piezo surgical assist? Can you give me MSDO, mandibular expansion? Is it those sorts of requests that are red flags, or is it the etiquette? In other words, is it the content that's disrespectful and that makes you turn them away, or is it simply
I
when
will
they
say
come in entitled and rude?
I will say it's a yellow flag, not a red flag.
Okay.
Because there's some patient after I explain to them, they understand.
Mm.
Then those people are good patient.
Hmm.
If that person comes in, insists on something, call us back, insisting again. Call us back, insisting again. Then the red flag goes up. Then those are the patients that you know, no matter how you treat it, they will not be happy with it.
Mm.
So those are
Why?
the red
What
flag.
is that? A certain psychological profile? And you mentioned earlier you called it number two when we were talking about what qualities of remote patients, long distance patients, and you said something about maybe they have something going on with their mental health that might it's more than just a structure and function issue. It's maybe that combined with some sort of mental illness that's
Um,
predisposing them to seek this treatment and be very anxious about it and very demanding of you. Can you comment a little bit more about that psychological profile?
so first of all, I didn't mention mental illness. I say there are some other issues. I,
Sure,
I
my words, not yours.
yes.
Do you disagree with that characterization of it?
Um, it could be. It could be. I think there are some other factors involved. Okay, may or may not be mental illness, but there's some other factors involved.
Like what?
Um, just very suspicious type of personality, or the never satisfied kind of personality, or possibly just you know people who have keep on doubting every single process personality or pursue a perfection that doesn't exist. Those kind of personality.
So are
Okay.
you talking about looks maxers? Are you talking about people who come to you where they actually don't have a functional issue, they just want to change the way they look?
Oh, I do have a lot of those patients. Usually, I just send them away because
You won't take looks maxers?
I won't. The reason why is it's not my job description. If I would tell you, I will make you gray looking. I'm working as a plastic surgeon, so that's beyond my scope of practice. Okay.
Mhm.
What I always
Mhm.
tell patients is when we correct the jaw structure, we correct the deficiency. And most people, when the deficiency gets corrected, their face look more balanced and look nicer. So that's not my goal. It's the side effect. It's a good side effect.
Do
Oh,
you have certain questions that patients ask that reveal them to be looks maxers?
um,
Like, "Oh, doctor, what will this do to my cheekbones? What will this
yes,
do to my
yes.
interpupillar
They say I
width?"
want my cheekbone to be out more, and that's number one. I want my cheekbone to be out more. And the second thing is when I look at them, they don't need surgery, but they insist on surgery. And I ask them, "Do you have any airway issue?" They don't have airway issue, but I think my jaw need to come forward. Those are those people looking for aesthetic result. So I'm not interested to address the aesthetic result because I'm not a plastic surgeon. I cannot practice beyond my scope of practice. That's exactly what it is. If I do anything like that, if my main concern is to make you is address your look, then I'm practice beyond what I'm supposed to do. Okay. Again, I always explain to patient, we'll correct your jaw structure, we'll correct your function. Usually after you correct the deficient jaw, the person's look will look more pleasing. Okay. But that's the side effect. It's not our goal.
But what if someone says to you, "Doctor, isn't, straightening teeth cosmetic enhancement? So why can an orthodontist treat towards straight teeth, but they can't treat toward, um, wider cheekbones?"
That's a very, very good question. It's because our treatment is limited to orally.
Right.
It's kind of like a cosmetic surgeon won't say, "Hey, I can do veneers to make your front teeth look better. I can put braces on." They will be completely out of their school practice.
But what if someone says, "Aren't orthodontists already beyond the scope of their practice by trying to augment airway?"
No, we're correcting structure. So, so this is what I explain to patient in my office. Patient come to consultation with me is knowing that I never diagnose airway issue. I don't. I know some doctor send them to get tested and whatever. Great, okay, but I don't get involved with those. I address patients' deficiency in jaw structures. I explain to them the jaw get structure get widened. The added benefit is your nasal cavity gonna get increase in volume. That usually improve your airway, like it or not.
Mhm.
so so it's never my how should I do this? I don't diagnose airway issue. Okay, because
Mhm.
the airway issue technically, maybe the rule will change, should be diagnosed by the MD. That's why a lot of doctors send those tests to a lab, have an MD analyze it, an MD give the result.
Mhm.
Okay, that way you give a you. you get around the legal responsibilities.
Mhm.
Okay. But personally, we don't do that in my office. Okay. Patient comes in, they have narrow jaw. I say, I expand the narrow jaw, you'll be really easier.
So someone comes to you, doctor, you ask them, where did you hear about me? They say, "Oh, I saw you on JawHacks YouTube channel." Is that does that make you happy or does that make you leery of taking them on?
Um, I say it won't have much effect on it. It depends on how you present yourself. Like I
Hmm.
say, when you first call the appointment, talk to my office, um, and when we do the record, when I see you, when my office manager present the fee and the treatment plan, that's when we start making judgments.
Hmm.
We usually don't turn patient away the first visit. If there's any doubt, someone will raise the question. Then we discuss the issue.
Hmm.
And then my office manager and I would decide if we take on this patient. If nobody ever complains about anything, the patient should easily become a patient in a normal fashion.
Do you think that my channel and channels like mine that are educating patients about MARPI and similar treatments, has it had a net positive effect on your experience as an orthodontist, or has it been, quite frankly, a pain in the ass for you guys?
Excellent question. I think in general, your channel really improved the whole industry quality
Thank you.
because the patient's demand, then the doctor start realizing I need to learn new skills, right? A patient going to a doctor's office, the orthodontist, a garden variety orthodontist office, 99% of the office out there, never experienced in skeletal expansions, jaw structure correction. Patient comes in, sharp question, ask. The guy might say, God, you know what? I don't know how to take care of this patient. Let me research a little bit. They might get sent to my office or UCLA, USC, whatever. Then they have a second patient coming ask the same question. That usually doctors start thinking, hey, am I missing something here?
Mm,
Is it the industry progressing, but I got left behind?
mm,
Okay.
mm.
And the funny things that Dr. Lip can talk about, I haven't started doing structural correction and maximum expansion because he came to visit me. I say, hey, I'm start doing this, doing that. Uh, a normal, good orthodontist reaction is, am I missing something? Is there something new I need to learn? That's his reaction. He got on right away and it sounds reasonable to him. He become one of the top guys.
Mhm.
I know
Yeah,
he is the
sure.
top guy, I believe. So that's a normal reaction. So in your channel overall, promote the whole industry, make it to a higher standard. But like you said before, there's always this internet crazies to look for little things here and there, right? It's like you show a video, 90% of the time, patient have a normal response, the positive response, and 10% people have negative response to it and start getting a little bit, their mind start working overtime and thinking about all the different scenario weird stuff that you cannot help it.
Yeah.
So in general, I like what you do because you are raising the standard of the industry by a lot. Okay. I think more people should watch your channel and know there are treatment alternative out there. It's not alternative. It's a better treatment out there. I shouldn't say alternative. It's a better treatment out there that all orthodontists should follow. Okay. Our goal shouldn't be straightening teeth. Our goal should be correcting structure and function. Straightening teeth comes naturally. Okay.
Mm,
That's what I'm trying to push the change the industry, and you are in the front line pushing it because patient is the one that pushed the doctor to change. One patient asking question, two patient asking question, 3 patients, I guarantee the doctor will start changing their mind.
Yeah.
To come to look for more continuing education and learn more skills. So overall, it's a great establishment. Okay. But every great thing have little side effect on
Sure.
regular.
Do you think it's specific videos that I might make that highlight, let's say, downsides or risks with the treatment that cause most of the issues and cause patients to then fixate on those issues and become paranoid? For example, I did an interview last year with a guy named Ryan who had a really severe one-sided expansion, uh, 2 MSEs, all of it pretty much went to one side. I mean, one half of his maxilla was out in a different galaxy. The other one was still, right on top of the mandible. And then people became really concerned about asymmetry after that video. Is it videos like that that they need to be published, or maybe they don't? You can let me know what you think.
You know
But
what?
mm,
Another
patients fixate on the risk. People are more risk averse than they are upside drawn.
people like to hear bad stuff, not the good stuff. Okay. I agree with you. I think that video is very questionable. First of all, asymmetry is not a common thing at all. You can talk to Dr. Lipkin, talk to me, and talk to anybody else who have a lot of experience. I can tell you it's not. Okay. Second of all, is experienced doctor know how to look for those signs. When I see anything, even smell wrong, I take a new CBCT, check any other suture opening. Then we start the process, reverse process. But if you go to an unexperienced practitioner, then they might just keep expanding without knowing what's going on. Okay. And how do I learn my way? Hard way, of course. I had to learn to salvage the situation on this asymmetric expansion. But do I know how to take care of it now? I know 100% know how to take care of it. So asymmetricity is not an issue. Like Dr. Lipkin said, it's how you design it, how you work with it. There's no real asymmetry unless there's some other suture got separated, which we know how to recognize it. Any experienced doctor know how to recognize it. So it depends on which practitioner you're going to. And again, you know what? I have seminar teaching. I teach seminar 4 times a year, specifically talk about those issues that people encounter. So if you go to one of the doctor that went to my seminar, for sure they know how to look for asymmetry. So as patients come to me, they don't have to worry about it. Now, slight asymmetry is normal because you are not symmetrical to start with. Okay, it could be just because you're looking at it for long enough, then you realize what you're looking for is asymmetry. Because I had patients come in here and say, "Oh, you chipped my tooth." I go, "I didn't chip a tooth. Let me show you your scan in the beginning." That's the chip. But patient was not looking for it before. So once they look for it, they see every single little thing they think is asymmetry. But in real life, real asymmetry, we talk about suture separating unevenly. Those are rare, and those also happen to people who look for extreme. Okay, everything is moderate. When another common question people come in, they give me sort of yellow flag or close to red flag is, I want to get expand 10 millimeter. Why do you expand this millimeter? Those patients make me worry because, in my opinion, if you expand beyond 4 to 6, you're creating more potential problem. You might go into a territory that will create more problem than resolving problem. Because everything in life, moderacy is the most important thing, right?
Yeah.
The best compromise, the moderate, is very, very good. When you get expand, if you get a good 4 millimeter expansion, your airway going to improve so much already. 6 is some icing on top of the cake. Anything more than that, I think you're risking some other thing. Okay.
Like what?
I don't think your airway going to improve so much more dramatically. More extreme, you have more chance of other suture separations or fractures. So when patient want more than that, I explain to them, you might want to consider surgery. Okay, have the surgeon move your jaw apart more, because if you want to get airway correction or anything like that, 4 to 6 more than enough.
Mm.
Okay,
Hmm.
maybe surgery correction is the thing that you should be looking for. Versus will keep expanding, and then eventually whole can of worm open up. Then great. Now how we're gonna take care of it?
What about with mandibular expansion happening at the same time? Does that open up the door for more maxillary expansion?
Mandibular usually we do arch expansion, just simply raise up the molars, and upper would tip it back in. That's how we
What
measure
about
expansion.
mandibular skeletal expansion?
We don't do that because I haven't seen a patient actually need that. Because usually when we do surgery, when you advance your lower jaw, the wider part of lower jaw shows. Okay, so the lower jaw advancement sort of take care of those problems. I haven't seen a real case. So it becomes if you like to do those procedures, then if you have a hammer, everything look like a nail.
Yeah.
Okay. If I can do almost 800 cases without doing one, and Dr. Lipkin, I don't know, 700 many cases without doing one, then you know what the possibility are. Because once you have a mandibular advancement happen, then your lower jaw, the wider part comes more forward. That's more than enough to solve the issue.
But how is mandibular advancement happening with your typical MARPI treatment
Now, mandibular advancement, if those patients need it, then we send them to oral surgeon to get a
for
consultation.
surgery? Sure.
So they will most likely to request the lower premolar being extracted, so lower jaw, lower front teeth get pushed back a little bit, so the lower jaw come forward a lot.
Right.
So the wider part of lower jaw actually show through. This is doing something that you expand the lower, and some potential side effect with the TMJ, potential side effect with the loss of papilla. Okay, and to me, it's just not necessary. I can finish a patient very nicely and properly without doing those. Even the
Hmm.
oral surgeon I talk to that take care of a lot of my patients say exactly the same thing. A lot of times there's no need for that unless patient is syndromic, they have an extremely micro-sized lower jaw. Then that's something that we can consider.
Hmm. Hmm.
Okay, to do a real splitting the lower jaw, it just create more problem in the future. And I think
Hmm.
and lower anterior teeth are very sensitive because their roots are really skinny, very tiny. Anything drastic would happen, you pretty much kill the lower front teeth. They don't have a
So,
large hole.
so is it that mandibular skeletal expansion is too risky in terms of potential complications, or is it that mandibular skeletal expansion doesn't offer any additional upside?
I don't. I think both statement could be true. Okay, because I can correct them without those. I can correct without once I upright the lower jaw. Once I start uprighting, the I would say 90 something% of patients with small upper jaw, the lower teeth are compensating this way. Once you straighten out, you easily increase 4 millimeter width, easily, and
Mm.
then you top by tipping in, then expand more. Like I said in my first video interview with you, I'm not sure if I said that. I think I did. It's a for a patient without crossbite, I can easily expand 4 millimeter,
Yeah.
okay, even 6. Now,
Mhm.
if I have to expand beyond 6, then I start worrying about it.
Then you start worrying about issues in the upper face that are unrelated to the mandible. You expand people only up to 6, not because you can't get the mandible to match, but because you're worried about other things in the
Yes,
upper face?
I never insist on how much expansion like we give to patient. I always tell patient to be the judge. I will
Mm.
tell patient, look like you can get expand another 20 turns or 40 turns, but I want you to decide. Look at your facial changes. Anything you don't like about your face, you stop right away and contact me. I don't have to insist on you on expand so much. Okay,
Mm.
I can work the compromise. The most important thing, you got to be happy with your face afterward.
Yeah. Yeah.
Okay,
Yeah.
so patient's the one that decide how much expansion they're gonna get. Now, if the patient keep on insisting on expanding more, I also gonna explain to them, I do not recommend to expand more because you're not gonna have a proper bite. Plus, your jaw look way too wide. Okay, and
But what if
secondly,
in those but in those cases, doctor, what if they could just expand their mandible with it? I'm not I don't care either way. I'm asking because I know that's what my audience is thinking. They're
yes,
thinking, "Oh, but if you could split the mandible, then you could get a good bite
no,
and your face wouldn't look funny because the mandible would widen to match the cheekbones so you didn't have the balloon face, the
no.
V shape."
The one the cheekbone, it's usually facial proportions called talk about balance. Okay, patient with wider cheekbone look usually have small jaw. They come with it. If you have a strong jaw, you don't get this wider cheekbone issue. So usually those patients need to go through mandibular advancement to make the whole face balance. If your lower face are inward, then your cheekbone always going to look big. So it's about the balance. That's in my
Sure.
opinion. So mandibular advancement is, in my opinion, that's very predictable. We've been doing that forever. Okay, I don't know if it's 100-year history, possibly. People doing mandibular advancement. Okay, it's a very predictable procedure that oral surgeon does it all the time. It's one of the very common orthodontic, I say the most common orthodontic procedure, mandibular advancement.
Mhm.
So they're pretty good at it. Okay, this is something that might potentially cause gingival recession, cause the death of tooth, cause a lot of other issues, and to make your jaw wider and potentially cause TMJ issues. Then those are the part that become unnecessary. Of course, you
Mhm.
could do it. Then there's some other risk factor involved. Personally, I don't like a patient with a big wide lower jaw. I like them to have a nice long sharp face.
Mhm.
Okay,
Mhm.
that's what the chisel come from, not the square jaw. Chisel come from this angle. It's by lower jaw coming forward.
Mhm.
Make it wider, just make this much flatter, then you get more square face look.
Mhm.
Does it
I
make
yes, it does. I
it is
spoke with a pa
it is an option. It is an option, but I haven't have to need to exercise the option.
yeah. It just seems to me that orthodontists, maybe not you, but other MARPI providers are feeling really handcuffed by the fact that the mandible can't match the maxilla. So, for example, I consulted with a patient about a couple months ago who showed me 3 treatment plans that they got in New York City from a couple of New York MARPI providers. 2 of them had SFOT on the lower as part of the treatment plan. So that's an invasive surgery too, where they're flapping the gums and they're packing in bone and doing corticotomies to help the lower teeth expand more. And I'm thinking to myself, she's really, really trying to find a way to expand more with the MSC and keep the lower to match. But this SFOT doesn't seem like the most elegant solution. Why do a tooth-borne expansion when you can split the mandible and get a skeletal expansion? That's where I'm coming from.
Mhm. The problem with that is you have a lot of changes. Okay, first of all, your condyle part will change.
Yeah.
Okay, and the TMJ is a mysterious animal. They don't like changes. They like comfort. So if you do an invasive procedure without knowing what you're getting into, that's one big problem. Secondly, is I think a lot of time different doctor have different opinion. Okay, for me, I don't do a lot of SFOT. I have a few SFOT. I do a lot of not a lot, some corticotomy, which I just simply use piezo going between the roots to help the teeth facilitate to move easier. Okay, that worked out pretty well. Okay, SSOT, I'm not in favor of procedure that much. Okay, but by simply straightening out the teeth without losing more bone, that I can easily already get, like I say, 2 millimeter each way, so you get 4 millimeter wider.
Yeah.
And again, if the patient is lower jaw deficient, pushing the lower jaw forward, it's the main way to balance the face. That's my opinion. Patient will look great. This is looking wide. I don't like the square face. And maybe because I'm Asian, a lot of Asian have to follow that big square face. So I'm not in favor of the square face. I like long, chisel, sharp face. Okay, that's um, what I prefer. So by pushing the lower jaw forward, again, the wider part will show through in the front.
Mm,
Okay, so the wider part used to be on the back, now more in the front. So you have a lot wider part. At the same time, make your face longer, sharper. I think it's a much better look than say make this part wider so I have a more of a square face.
mm-hmm,
Okay,
mm-hmm.
so that's my part. I don't know how Dr. Lip can look at it. Maybe he can ask his opinion.
I have asked him about
Yes,
mandibular skeletal expansion. He voices the same concerns as you. He does not offer it. He doesn't think it's necessary.
yes. So we both have a tons of experience on this factor. Okay, we treated tons of patients without it, and they look great. I think, like I say again, people think it's a width issue. It's not. It's an anterior posterior issue. It's an AP
Yeah.
issue. Massing is a width issue.
When you advance the mandible, it appears wider because a wider part of it is becoming more in the forefront.
Exactly. And then if you accompany with the extracting the lower premolar, push it back so you can push more forward, then the wider part come out even more. So your jaw is much wider. At the same time, give you a nice long sharp face. This is your lower jaw's more inward and then give you a square face.
Hmm. Is that one of the rare instances where you think extractions are appropriate?
I think for mandibular advancement extraction is very appropriate. It's very appropriate because you don't look at the process, you look at the end result. If the
Mm,
end result meaning your jaw can come forward more, and the wider part can come forward more, then your end result is what's favorable, right?
yeah,
You have a
yeah,
wider jaw, more nicer looking face, and open the airway dramatically a lot more when you
yeah,
extract the lower premolar.
yeah. You're
This
sacrificing pawns to get the queen.
Yes, exactly. So you have to look at the end result. You don't look at the process. Okay, if you remodel a house, you walk in, you see the floor lift up, the wall is down, you get mad at the contractor. Okay, so why you make such a mess? Okay, that's why contractors say don't come take a look until we finish. You look at the end result, you don't like the middle.
Right, right.
That's why I tell
Doctor,
people
we're
all the time.
oh,
Hey,
absolutely.
this way and that way, this hitting harder, that was I say it's remodeling progress.
Yeah.
The
There's a
wall gonna be
long,
the wall gonna be down, but the end result is what you're looking for.
yeah, yeah. People have to be tough to get through the messy phase of, especially MARPI treatment.
Yes, you want a good
Few
result.
more.
This is what you would get.
Right, right. Like any creative endeavor, there's always a chaos phase.
Yes.
A few more minutes, doctor. I want to ask you two more things. You don't have to comment maybe on your own expansion in case you want to, but it's pretty widely known out there that you've had your own MARPI, um, in that you used a FaceGenix expander, FME.
Hmm.
Do you want to comment at all on your thoughts on that
Now,
appliance and your experience with it?
now my first expander was a custom RP.
From
Okay,
Partners Dental
from
Lab?
Partners Lab. Yes,
4 tads, 6 tads, 8
eight
tads?
tabs. 8 tabs. 8 tabs. I got a small expansion for about I think 1.4 millimeter, and then the MAPI fell apart. I think at that time because it's so new, they're learning too. So it was not constructed in the sterling way, so part of it fall apart. So I end up have to remove it. Okay, and and right now I'm still using Partners Lab Marby. Okay, they produce really good result. So I think they learn from that lesson. Okay,
Sure.
and 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 the owner, no, I wasn't very happy about what's going on, and he's a really great guy. So they made the modifications. So right now it's a pretty reliable product, I would
And
say.
you're treating patients with it.
Yes, right now it's a pretty reliable product. Um, uh, the
Then what's the story
FME,
with the FME? Yeah, how did you end up
FME
with
is
an
a new
FME?
player in the market. They are still improving. Okay, right now we they are my FME case is on hold right now because they're making a newest version, which is a lot more robust, okay, than their first two version. They make the whole appliance a lot beefy, and I think they have really promising future. Okay, and this is design superior than MSC. I definitely think so. The insertion part is super easy too. Okay, and the basically the lab designs it to where you can have thicker bones at, and then they give you a splint, put it on, so nothing could go wrong. Same thing as the partner slab custom RP. They're pre-designed position, not like MNC. MNC, you kind of had a position in, check in your office, make sure you do it right. MNC have so many things could go wrong. Okay, but those two have less things to go wrong. So the FME right now is waiting for the stronger version. When they put in mind, there's a something happened is that I waited for too long. So I had a code economy. Dr. Lipkin did for me. He did a great job. And I hard heavy with
Piezo?
him. Piezo, yes. But after we get rid of it, I I let it heal for a little too long time. I think my situation when I look at my X-ray is my cut actually healed without suture. So when a second time goes in, I don't have a suture to open. That's one piece of bone.
Wow, because it
So
heals stronger, you could
yeah,
say.
so my FME didn't work well. Okay,
Wow.
didn't work well. I think the reason why because my bone healed. Okay, because you interrupt the suture. Okay, so from my personal self, I learned that if I do the corticotomy, if I'm gonna put a second one in there, I need to refresh the corticotomy. Because
Yeah.
remember, imagine the whole suture was interrupted, so they heal like one piece of bone.
Mhm. Mhm.
Mhm. So I'm getting soon. I'm getting another either FME or MARPI. Okay, and then I'll probably have to go through the corticotomy again to get it cut separate in the middle so I can expand more. And my
Mhm.
goal for myself is about 4 millimeter expansion. So I only need maybe another 2.5 millimeter expansion, then I'm happy with it.
What's it been like for you to go through the same frustrations that the patients go through in terms of having failure to split and, uncertainty about whether or not it's gonna work?
I say I went through more than any of my patients because my custom RP have 8 TADs in there, not 4, 8 of them. So the process is a lot more harder, but then I didn't really experience that much pain. There's a minor discomfort. I flew back the same day from Dr. Lipkin's office in New Jersey back to Southern California. The only thing that bothered me the most is I can't eat properly, so I got to get used to it. So my tongue hurts more than anything else. My corticotomy cut was so beautiful that it doesn't even hurt me at all. Okay, and my
Wow.
six, my next FME, I have 6 TADs put in, so I totally have 14 TADs in my mouth. So I went through more than any other patient ever went through. So I
That's
can tell you
karma,
the
doctor.
expansion is not that it's not as horrible. The most horrible part is my tongue. I have to get used to it, get used to talking with the custom RP. That's the worst thing. Corticotomy cop doesn't even bother me at all. Okay. So to
Mhm.
me, it's a piece of cake except the tongue and then the beginning learn how to eat part. And and
Mhm.
I went through failure. Okay. So I want patient to know failure it's real. It's not doctor did a bad job. Think about this way. I'm one of the very experienced one. Dr. Lipkin is one of the very experienced one in the world. So two of us get together and I even go through failure on myself,
Yeah.
right? So do I blame anyone doing a bad job? No, I can't. Dr. Lipkin did an excellent job under my watch. If it's gonna fail, it's gonna fail.
Yeah.
And so in my personal cases, I did it myself first. So I know what the failure looks like. So if they fail, most important thing I think patient need to know is not to point finger and blame, because nobody wants failure. Your doctor will not intentionally want to fail your case unless it's something wrong mentally. Nobody want to fail your case. Everybody want to be successful the first time, but there are chance case will fail. Okay, and I won't even consider my case a failure because I got 1.4 millimeter expansion, so I know I am expendable, which is the
Mm-hmm.
great news, and I already enjoy the benefit of that. Okay, my acid reflux went away. I was talking to a few people about it. So that's already one of the benefit with only 1.4 millimeter expansion. I cannot wait to expand more. Okay. So if you any patient's doctor fail on your expansion, not necessarily mean they're a bad doctor. That means that this case does work this way, and then given a chance come back do something else, eventually you get expanded. That I always explain to my patient that there's always a way we will be able to expand you as long as
Yeah.
you're up to it. This way failed, which would use a different device for a different position, maybe go to surgical assist or corticotomy heart a little deeper, then eventually you'll be successful.
Yeah. Yeah. I think that a big problem is that now more than ever, people are not working with their hands. Everyone is doing digital work. No one is in the construction trades anymore. So people don't realize that there's a physical material world beyond their head. They don't understand that when you're working with bone and skin and metal, screws, and so on and so forth, it's not always in your control. The physical world has a reality of its own, and patients have a hard time grasping that. They think that going to the doctor is like going to the Apple store. Guaranteed you're gonna get exactly what you want. iPhone 14, black, 128 gigabytes, swipe your card, and it's finished. It's not like that when you're working with materials.
Yes, yes. And there's a last part before we end this review. I want to talk about, in this consultation, I want to talk about reviews. Okay. And you know how there's a lot of internet heroes thinking they can write review to destroy business and personal vengeance and writing reviews and stuff like that. And remember, any single thing you put on social media can come back to haunt you. Okay. A great example is right now, I know a lot of people hiring. When they're hiring, they look at your social media. Okay. It's a very common thing now. Actually, a lot of hiring company, HR company recommend that to see if that person social media posts fit your personality. Okay. There's also a lot of talks. I was approached with ideas on different advertisement company talk about they will be they like to track a person's reviews. Okay, so the purpose of that tracking the reviews is you could filter out the toxic people and the regular people for your customer. Okay, and restaurant they don't have luxury. Doctor's office or any other higher client services like yourself. Okay, those company want to establish the format to track your this person. For example, you have a client contact you, say, "Hey, I want to switch to your accounting company." Then you can actually those company would track the person, see how many bad reviews you get out there, see how positive the person is, or a toxic person that you have to deal with. Then you can have your proper selection. Okay, this kind of stuff is happening. Okay, and and a lot of time, the generation now, as everything you don't go their way, they threaten you with reviews. So the review will come back to haunt the person sometime.
That's very interesting. Do you have any final advice for patients, doctor? How to be a good patient?
How to be a good patient? Final advice is, um, again, you are talking about a very small group of doctors who know how to treat your specific situation. You don't, you can't really be um, thinking about you can burn bridges, giving a hard time, and then move on to the next person. It doesn't really happen like that. Like I say, like you said yourself, probably 10 doctors in this world really treating this on the very experienced basis. Okay. And if you are being a difficult patient, you will run out those 10 fingers pretty soon. And then you will find yourself in a situation that nobody willing to take on the cases unless you find a person who's not familiar with anything to take care of those kind of problem. So be nice, be respectful. Like you said before, you respect the doctor, respect their opinion. Don't be argumentative. Don't give them a hard time. Don't don't have you going to the restaurant give the waiter waitress hard time situation in the office. Then you would just do fine. Just be a normal patient that present yourself to the doctor and don't raise a red flag. Be a normal person. Be reasonable. Okay, and act normal, act reasonable. Then with normal expectation, not extravagant expectation, then your relationship with doctor will be great. Okay, we are orthodontists are intrinsically nice people because we treat happy patient. Okay, orthodontist office usually have a very happy environment. The assistants are happy, the managers are happy, the front desk are happy because we see a lot of pleasant people who want to improve themselves, not people who come in with pain and complain. Okay, so we like to keep it that way. And so if you present yourself with a good attitude, people think you easy to work with, then there's never the issue. We will find the proper care that you deserve. But if you come into the office with the attitude of, I don't trust this, I don't trust that, I'm going to question about everything, I don't like to pay, I don't like to do this, I don't like that, then you will encounter a problem. Again, there's only not that many doctors who's very experienced at this. Then it's not like a restaurant. I don't eat here, I can eat next door. But unfortunately, and especially we all spread out different part of the state, different part of the country. So it's not like you can just go next door and find someone else do exactly the same treatment. And we're not McDonald's. So be careful how you treat and respect the doctor you want to stay with. You don't want to burn the bridges on the person you will need help from. That's the bottom line. I personally don't burn bridges. That's what I learned since I was young, like yourself.
And I think if patients can learn how to navigate their orthodontic treatment, they can get a lesson for life in general about how to treat people and how to conduct business.
Yes, I agree with that.
Well, doctor, thank you for your time. It's been a pleasure, and I look forward to speaking to you again sometime. Have a great weekend.
Thank you. Thank you very much.